So if you remember what originally happened, the money was going to be put towards the beautification of the entrance of the hospital. What then happened was there was very strong public reaction against the spending of the funds in that way. So when I was elected into this ministry, we stopped that and we committed to giving the public the ability to voice what they thought the money should be spent on. So in that year and 3 months since I've been in office, by the time that you ask the public to get the email replies come in, we've constituted a committee. And as Paul Lyons has said, the committee has met on 5 occasions. First of all, to determine the remit, to determine what they wanted to spend things on, what they didn't want to spend things on. So the period of a year and 3 months has gone on pretty much that consultation with the panel itself, determining what to spend the money on.
Some of the measures announced here include training for nurses. We've seen from Unite criticism that nursing levels are dangerously low. How far does this go towards addressing that? I know it's an issue that you want to tackle separately, but do you have that in mind?
So we are trying to train nurses in Gibraltar. There are courses in the university now that train nurses, and a lot of the equipment that we've actually purchased is to assist the university to deliver their courses. So, for example, there is an ANDOL, there is an AND simulator that allows nurses to intubate the dolls, to train them how to intubate patients, that teaches them how to do numerous procedures that would be required in, for example, the CCU. So the idea is to train nurses locally as much as possible, and yes, indeed, a lot of the equipment, a lot of the training, etc., does go to the training of nurses in the allocation of the funds for this year.
In terms of spending the £2 million that remains, can you guarantee that they will, that you will reconnect with the public and deliver what the public wants?
I think that what we're trying to do is pretty much listen to the 83 suggestions that were received to see the direction of travel that people want that money spent on. We've received responses from individuals, from charities, and indeed from the organisation itself as to where they'd like to, or rather individuals within the organisation as to where they'd like to see the money allocated. So what we're intending to do is, with that ethos and with those emails in mind, look to spend the remaining funds available. So we will always spend that 2 million with people's views in mind.